For the past 4 months at Select Dance in Shakopee, 5-year-old Mason Hansen can't get enough of his hip-hop class.
I think this is something where we've seen he's been able to stick with it, and he feels confident when he's there, and he wants to go back.
Pretty much every kid here is the same age and same skill level, but every child is not like Mason.
I don't think he really realizes some of the challenges that he's overcome. It just is more of a way of life for him.
You see, Mason dances to his own tune of sorts, as it's difficult for him to move his right side. All of this caused by an in utero stroke. That's right, it happened while Mason was still growing inside his mother, Rihanna.
I think it's something that we just thought happened to adults or older people, that we never really even conceived that could happen to an infant or a child.
Rihanna says her pregnancy was normal, Mason's birth uneventful. But at around 4 or 5 months, Rihanna and Josh Hansen started noticing the differences in Mason.
It's somewhat normal to display a preference for one hand, but his was becoming very, very obvious that he was neglecting his right arm and side altogether.
At 6 months, the CAT scan confirmed what doctors suspected.
We'll ask him, what does this mean for Mason? What's his life going to be like? And every one of them said, we don't know, we can't say. Every child's different.
Now at the age of 5, Mason is really no different than his brother or sister. He just compensates. Here you can certainly see how he favors the left side. But there are challenges, and leave it to big brother Evan to lend a helping hand. But others will not always be there for Mason.
Almost there.
So therapy has become a way of life. At Capable Kids in Chaska, occupational therapist Carrie Jankowski uses different activities to help Mason adapt and grow.
We are working on him engaging his core muscles to stay on the tire swing so he doesn't fall off, and needs to make him aware of the right side of his body. Let's draw one big circle.
With Mason, he often does things a little later than a typical child.
Whoa.
At therapy, he's learned how to dress and feed himself.
Good pedaling, Maisie.
This video at the age of 4, the first time Mason rode a bike.
You ran into me.
Him hitting those little milestones are just fantastic. I think we get so excited about them because it reassures us that we know he's going to get there. It's just he's going to take his own time getting there.
So how does an in utero stroke happen?
We don't know a lot about what actually causes it.
Neurosurgeon Andy Grand at the University of Minnesota says a mother has no way of preventing an in utero stroke or knowing when it takes place. In utero strokes can happen any time, from conception until the child is born.
Those that occur very early on, typically the symptoms of the child once they're born are much less than they are if that stroke occurs later during the pregnancy.
In utero strokes occur in 1 in 3,000 births, with a 95% survival rate. Out of that, 50% of them never show signs after they are born.
Their brains rewire, and as a consequence, the deficits that they may have early on go away. And so the stroke is never recognized.
Push, push.
But it's that other half, those like Mason, doctors worry about.
We want them to have a normal life, a very rich life, one without these deficits.
That is why Dr. Grand is so excited about research going on at the U. One of the treatments being researched is called neuroplasticity.
It's essentially the idea of rewiring the brain or an area adjacent to the area of injury, essentially assuming the role of that injured area.
Yeah, that's good. Get it in there and give it a real tight squeeze.
So hopefully in the future, that injured area of the brain can be corrected.
That's some great work right there.
And life will be a little easier for those like Mason.
I'm very hopeful that we'll be able to offer therapy for kids who have had a stroke in utero, even if it's recognized 4 or 5 months later.
There you go. Run, go!
Thankfully, Mason's physical challenges don't hold him back, but the Hansens still worry, like any other parent.
We're worried about how he's going to fit in socially. Kids do notice that his foot kind of turns in a little bit, and he needs some extra assistance from the teachers as well, just carrying a tray in the lunchroom, things like that.
Heel, toe, drop.
And when you see the moves Mason's learning for his recital, you can certainly see how much he's overcome. But his parents ask you not to focus on his challenges, but rather the lessons children like Mason can teach us all.
And I don't think we really look at him any different or treat him any different because of that, and I think my hope is that nobody else does as well.
At first, it's very scary, and it's not the end of the world. It's your life becomes different. It's maybe not exactly what you expected, but it is such a journey, and it's so rewarding.
What an awesome little boy. And he's got some moves.
Yeah,
I like it.
You dance better than I do, Mason. Way to go.
Not not saying much, but that being said, cognitively important to know that Mason is right on track with his peers, and his parents are hopeful that he'll continue to make strides with his right side.
They add organizations like the Minnesota Stroke Association have been great mentors in their journey. And stroke is the leading cause of death and disability in Minnesota. In fact, every 40 seconds someone has a stroke in the U.S., and every 4 minutes someone dies from a stroke. It happened in my family with my dad, and that's why I'm honored to be hosting this year's Strides for Stroke Walk coming up May 12th at Como Park Pavilion. In fact, you can join my team. Come on aboard. We're going to raise a bunch of money to help out the folks with the Stroke Association. And for more information, we have a link on our website at myfox9.com. Help out people like Mason, too.